All right. Hello, everyone, and welcome. My name is Lauren Lewis, and I am an Impact Austin member, class of 2020, and I am honored to welcome you all here to Impact Austin's Women Leaders webinar. I think it's safe to say that we are in a time where it seems difficult to find the good news, so today's event is dedicated to just that. Let's kick off the week with some positivity. We're here to shine some light and hope on the good things happening locally. Today, I'm not only joined by Impact Austin's Executive Director, Christina Gorczynski, but we're also joined by the incredible leaders of two of Impact Austin's 81 community partners, Starla Simmons of Black Mamas ATX and Kristen Pierce-Vreeke of Austin Child Guidance Center. Part of the reason I joined Impact Austin when I first moved here from Detroit 2 years ago was because I wanted to learn about the city that I was moving to, and I knew it was important to understand the history and the current challenges that it's facing. Impact Austin has provided me an amazing opportunity to listen, to learn, and when appropriate, to take action. At the heart of Impact Austin is grant making, but I have seen firsthand how an organization can grab our heartstrings and call us to get even more involved. In fact, that's how I became a CASA volunteer. After last year's Women Leaders event, with CASA CEO Laura Wolf, I knew it was a cause and a volunteer opportunity I wanted to get more involved in. So I took the next step and have been officially sworn in as a CASA volunteer now. So today, as you listen to Christina, Starla, and Kristen share the work of their incredible organizations, the impact they continue to make, especially after everything thrown at them, especially over the last 18 months, a global pandemic, a historic freeze, and so much more. I implore you to find the ways to get even more involved with these organizations or other great causes. And if you need some suggestions, take a look at our impact page on the website, which highlights the work of all of our amazing community partners. And now I'd like to hand it over to someone who really needs no introduction, Impact Austin's fearless leader and executive director, Christina Gorczynski.
Lauren Lewis, thank you so much for that welcome, for that incredible testimonial and overview about Impact Austin. And so, yes, I am Christina Gorczynski, and I am the Executive Director of Impact Austin. And I also get to welcome you to Impact Austin's Women Leaders event as we continue to fundraise for support for Impact Austin's community partners, build philanthropic relationships, and most importantly, build philanthropic champions in our members and beyond. So we're here to celebrate women's philanthropy, our high impact grant making. And so for most of you watching, thank you so much for your contributions that you make to Impact Austin and to our community partners through your membership. And probably thank you to every single person on this call for everything you do to Central Texas organizations, both big and small. So as a women's collective giving organization, we welcome all women with a desire to give back and make an impact. Whether you're brand new to Austin, like Lauren, who moved here, you have lived here for years, like so many of our members, you're a beginner to philanthropy, or you're really well-versed in collective giving, we want you to join us in this amazing movement. So we meet you wherever you are on your journey, and we travel together to make a huge impact. And collective giving, for those who are new to the scene, is a form of grant making and giving that is done in a group. So each member of this group of Impact Austin contributes financially to a grant pool that is distributed twice annually. So for more members, and my plug for membership, more members means more dollars out into the community and more female philanthropists engage, which is our primary mission. So 18 years later, Impact Austin, we're celebrating $7.6 million out into Central Texas nonprofits. That was collected $1,000 at a time with those impact grant contributions from members. But also with membership, I want you to also keep in mind, as we're hearing from these amazing women leaders today, that you have an opportunity to also expand your knowledge, share your talents, and build your network as being part of this organization. Our work has continued during the uncertain times, and we've been doing so much of our programming online. So we thank you for being part of that programming. especially our grant review committees. I want to do a shout out to our grant review committees that are meeting right now virtually to narrow down the grant applications for our equity grant and our health and well-being grant to 2 finalists for our members to vote later this fall. The spring grant review season will get kicked off in the spring, will get kicked off at the beginning of this calendar year. So make sure to stay tuned for members. And if you're interested in joining, that is your next opportunity to jump on a grant review committee. So because it's a moment to be able to say it to everyone publicly, that Impact Austin always works to use our collective resources for good. We stay informed, and we're always looking for better ways to support our nonprofits who are ultimately those who are addressing big issues in the community. From COVID to the freeze, this year has presented a ton of issues and big new issues, but it's been amazing to see how many big new solutions have come out of our nonprofits and really just from also our Impact Austin membership. Quick plug, and then I get to turn it over to Lauren to introduce you to our amazing speakers. A quick plug for our Girls Giving Grants G3 program. It's Impact Austin's youth initiative made up of young philanthropists. They are in grades 8th grade to 12th grade. And each G3 member contributes towards impact grants. They contribute $125 annually, and together they have donated nearly $10,000 out in the community. They're actively recruiting, and so if you know girls in your life, whether they are in your life because they are your neighbor's kids, they're your own kids, they're young people that are in your classes, please send them to girlsgivinggrants.org and they can learn more and sign up. So, Lauren Lewis, I'm going to turn it over to you to get our program started. And thank you again so much for everyone for joining us, for taking an hour of your day to come be part of this.
Thanks so much, Christina. Now I would like to introduce both of our speakers. And before I do that, we will have some time for Q&A at the end. So if you have any questions that pop up during the presentations, please throw them in the chat and I'll be sure to ask our panelists. So first, you will be hearing from Starla Simmons. Starla is a clinical assistant professor strongly rooted in social justice and racial equity. She worked in Austin ISD for over 10 years, providing a range of direct care services to families, students, and staff. Starla has passion for supporting the vitality and resilience of communities of color. She's experienced in holistic practices such as ecotherapy, mindfulness, and trust-based relational intervention. In addition to direct services, she worked as the liaison and coordinator for AISD's school mental health centers, providing consultation and operational support for school-based therapy services at 19 middle and high schools. Starla has facilitated trainings in Austin nonprofits around the topics of racial equity, social justice, mindfulness, self-care. Previously, she served as an Austin leader for the national nonprofit Outdoor Afro, which celebrates and inspires Black leadership in nature. She currently serves as the board chair for Mama Sana Vibrant Woman, a local nonprofit that provides pregnancy and birth support to women of color. After Starla's presentation, you'll be hearing from Kristen Pierce-Vreeke. Kristen is the executive director of Austin Child Guidance Center and the first woman and person of color to serve in that capacity. She's a licensed marriage and family therapist and supervisor and is passionate about supporting and advocating for the necessary resources and access to mental health services for all children and families in Central Texas. A principled servant leader, Kristen is a frequent speaker in the community on mental health topics. She hosts ACGC's Thrive Building Resilient Families podcast and believes strongly that the key to strengthening our communities lies in raising confident and empowered children. I can't thank you enough, both of you, for being here. And Starla, please take it away.
Thank you. I'm going to share my screen really quickly. And while I'm sharing my screen, I'm also realizing I never gave you my updated resume. So I'm just going to say quickly that I'm no longer the current board chair at Mama Sana Vibrant Women. That was a former. So thank you so much for having me. I am so honored to be able to be here and speak with you all today, and seeing some wonderful colleagues here, knowing that I have some support from my UT School of Social Work. As was mentioned, I'm the Interim Executive Director for Black Mamas ATX, and currently a clinical assistant professor in the School of Social Work at UT. So hook 'em horns. And just have been so excited to be a part of Black Mamas ATX over this last year. And I can't tell you how amazingly hard and connected and talented, brilliant, caring, social justice oriented group of people that I've ever worked with. So I'm just like so happy to spread the good word about Black Mamas ATX. Thanks for having me and having the support for Impact Austin. So for those of you who are not familiar with Black Mamas ATX, we are a nonprofit and research project out of the UT School of Social Work, with the mission of ensuring that Black women survive and thrive before, during, and after childbirth. We envision a world without maternal health disparities, and ultimately our goal is to reduce and eliminate the alarming maternal mortality and morbidity rates among Black mothers in Central Texas. So we are really formed because of a need in the community, formed and led by Black women, circling around each other around this really, really frightening and real disparity, the Black women dying during childbirth. And it started out as in 2019, Dr. Michelle Roundtree, through the School of Social Work, began the Black Mamas Community Collective. It was a research project that was funded by St. David's. And I just love the history because it really has been a grassroots effort. It was a community of researchers and social workers and medical, public health professionals, activists, community health workers, organizers, who really saw the need that was happening and came together to come up with a solution. And so from that, this community collective, Black Mamas ATX, which is the nonprofit, was born. And we are offering a scope of perinatal services to the community, serving Black women here in Austin and also, well, in the 5-county area in Central Texas. And with the support of Impact Austin, we're moving to Manor, so I'll talk a little bit more about that. But this organization was really rooted from the need and then the community of Black women and the people who love them coming together to fill that gap. So a little bit about the facts, because we always have to talk about, why does this organization exist? Well, in Central Texas, this is the recent data, between 2012 and 2015, Black mothers accounted for nearly 12% of all the births. However, we are dying at 1.5 rate higher than white moms. And historically to now, across the nation, Black women are dying at a higher rate than any of their peers, any of their counterparts in the United States. And a lot of these pregnancies deaths are really preventable. And so looking at the disparity, there's certain factors that come into play. And one of the biggest factors that we've named is racism, that the allostatic load that Black women carry, dealing with disparity and discrimination, the stress, all of the kind of intersecting issues that living in a Black body really carries, is one of the causes. And so we are looking at this large disparity and figuring out, what can we do about it? And so Black Mamas Community Collective and other Black maternal health activist groups around the country are really putting in programming, at the level of like finding Black doulas, raising awareness in the community around this issue, because it's surprising, right? It's surprising. And also finding at the policy level to make sure that Black women are being taken care of. And one of the interesting facts, when I remember just kind of starting to learn about Black maternal health, when I was pregnant with my 2 kids, learning about this and thinking like, I mean, I did all of the education, I am an educated Black woman, and still research has shown that even if you account for education and income, Black women are still more likely to die in childbirth. So we're really here to save Black women. And the work that we do around that is really not just having providers that look like us, so employing Black doulas, we have a Black therapist, but really also transforming the systems, really looking at the policies and the work that needs to happen in the community, as we like to call the social determinants of health, really circling around those issues to be able to create an environment where Black women are healthy, living in healthy communities, have access to the services that they need, and have healthcare providers that are using an informed lens around the various health issues that Black women face, and looking at those systems, training systems, getting systems to be informed that, hey, you have to use this, you have to use a lens that is looking at racial equity, that is looking at racism, that is looking at culturally congruent care, to be able to make sure that Black women are being taken care of in the way that will help them deliver healthy babies, which delivers the whole community, makes the whole community healthy. So it's really about improving the entire community when we really focus on what Black women's needs are. And shifting the narrative. You know, one of the things that we talk about with Black mamas is we don't want to be seen as, we don't want these experiences, right? And we don't want that to be the leading narrative all the time around what is happening, that it's, that, you know, a lot of times when you see a disparity happening, you think, oh, what could that person do to have had a better outcome? When really it's about the system, it's about the community response, the collective response to taking care and being able to dismantle the things that have caused the health of Black women in their perinatal, in their lifetime, be at this point. So Black Mamas Community Collectives is really part of that solution, you know, and that's the other thing we talk about is like, this is on the ground for us, by us work. So we make the decisions on our care. We decide how we're going to be having a successful pregnancy and what our options are. So we're doing a lot of things, but it's really about creating some village support at all the different levels in the community, all the way down to the one-on-one, the beautiful one-on-one relationships that we've created with all the mothers that we support during childbirth. So some of our services that we provide, I mentioned we have sister doulas. And one of the unique things about our sister doulas is that they are with these mamas from prenatal, like around 20 weeks. We try to catch them, not at the very end, but right to be able to start providing that prenatal education up until the baby is 1 year old. Because anybody who's had a child knows that once the baby's born, that's when it like really gets real, right? So, and that's also a very vulnerable time for the moms. When a baby is born, people say, oh, look at the baby, look, like, how is the baby doing? But we really make sure that we turn that focus and we support the moms and their partners and their families during that very sensitive time. So our doulas are visiting weekly, also providing depression and anxiety and postpartum depression surveys, and connecting with lactation consultants. We have a really high breastfeeding initiation. We have like 100% breast, everybody, we have a really high breastfeeding initiation success. So we're really proud of that we have some one-on-one support. And then our sister doulas also lead sister circles. Once a month, And they are a place where our mothers, both prenatal and postpartum, can come and talk about what's happening. Build that village, break that isolation, while also we have various providers come in and talk about perinatal health, lactation consultants. We've had a range of people come in and be able to spend time with our moms answering questions one-on-one and provide that support. And those have been highly successful. So this last year, we were able to add a social worker to our staff, which has been also, just like we said, we really closed the gap on this sort of holistic spectrum of services that we provide. And we're able to have individual therapy. We have soothe your nerves anxiety groups, trauma processing groups, effective Black parenting. Our therapist is also yoga certified, so being able to offer yoga classes. We have UT social work interns who are providing ongoing support in case management, referring our moms out into the community for anything they need, because we know that even though the primary thing we're kind of focusing on is maternal health, but we also understand that everything is connected, right? Health is really connected to our environment, to our relationships, and to the support in the community. So we're able to increase our capacity having social work on board to be able to kind of fill some of those gaps. So our doulas are able to really focus on the babies and the prenatal and the postpartum, and our social worker is able to provide that mental health and social support that's been so needed, especially right now during COVID, especially during Texas and specific with the freeze. That it's been a really hard year for people who have been having babies. When the COVID first hit, doulas weren't allowed into the hospitals. So mothers were trying to birth without support. And in collaboration with other maternal perinatal health organizations in Austin, we were able to collectively organize and write the hospitals and said, hey, we need to have doulas in. And so there's like more community organizing is really helping to secure the safety for mothers, saying like, this is unsafe to not have a support person in the room, because we know that impacts health outcomes. So we also have a community health worker who is on the ground in East Austin and able to, again, just be connected to what the neighborhood needs, what people need. We want to first and foremost respond to what our mothers need directly, and let that be the driving source for all of everything that we do. So having the community health worker has been really beneficial in helping us understand what the community needs. And all of our services are free. So when we talk about transforming systems, it's very important for me to talk about our partners in equity. One of the things that we also offer through Black Mamas ATX is in targeting systematic change. Joyce James provides a free training, and we're really a free training around racial equity issues, specifically in maternal health. And it's been a very impactful, powerful training to kind of understand the issues of disparity at a systematic level. And we've been able to reach a lot of healthcare providers, a lot of partners that we work with in the birthing world. And that has been such a great piece in knowing that, yes, we're providing this one-on-one support, but we're also impacting systems at a larger level. We're also part of the Maternal Health Equity Collaborative, which is a collaboration made up of 6 other partners: Mama Sana, Vibrant Woman, Healing Hands Community Project, Giving Austin Labor Support, and also Partners in Parenting, which is PIP. And oh my gosh, just blanked. I'm sorry. I think that I got everybody. But the Mental Health Equity Collaborative has been meeting since the beginning, formed at the beginning of COVID. Again, coming together to kind of wrap the arms around the birthing community and say, hey, where are the gaps? What do we need? How can we approach this work from a racial equity lens and how can we make sure that the whole community of Austin is growing and being cared for. So we, together with them, secured a grant from Merck, Safer Cities, and now Austin is a safer city for childcare. We have, we're able to offer free childcare to any Black person, Black birthing person in Austin, for any kind of perinatal need. So that we have childcare for missing doctor's appointments, childcare for respite, childcare for birth. If you got to go to the hospital and you have kids at home and you need childcare, we're able to provide childcare to be able to make sure that our birthing people are showing up to their appointments and getting access to the services that they need. I think more now since COVID, I think a lot of people really understand the need for childcare and how much that can make or break what you can do, right? If you have kids and you don't have childcare, then you end up missing a lot of things that you maybe would have shown up for. So we're really excited about this project and this grant because we're able to fill a gap in the community that's really important. So plug for that. We want to thank Impact Austin so much. So one of the things that's been really wonderful, and I'll talk about groundwater analysis here in a second. Black Mamas ATX, through the support of Impact Austin, has been able to expand out to the Manor area. And this is really important because we've seen the effects of gentrification on the Black community in Austin, and really having a lot of families moving out of East Austin and North Austin and more into rural areas. And so there are not that many services in rural areas. And this has been a really great collaboration between Manor AISD, Austin Regional Clinic, People's Community, and the City of Manor. They're really supporting us, helping us to come into their community and provide services at the school for teens, and also opening up all of our services for anyone in the community, and for us being able to come to Manor because there are very few, even fewer Black health providers in Manor. And so we're able to bring our expertise and our services to the community through Impact Austin. And we're happy, we're kind of extending the timeline on it because with the COVID and the freeze this year, things have been really hard to get going because everybody's kind of responding to crises and still in crises, but we're excited that project's gonna continue on through the summer next school year. And so we thank Impact Austin for that. I have a question about groundwater analysis. Is that literal or figurative? That's a great question, and I always forget to explain that. It's figurative, excuse me. So the training is called groundwater analysis because it is about looking at the root problem, right? So when you're looking at the groundwater, you're testing it, you're seeing what's in there. And that's what this racial equity training is all about. It's about going to the root of these disparities, sifting through, understanding what's in the water that's creating these outcomes. And so that's why it's called groundwater analysis. Thank you for asking that. That's always a question I get. So I think that was actually my last slide. But what I want to say is how you can get involved is one thing is we are always wanting to, please go to our website. It's www.blackmamasatx.com. There we have our intake forms. There you can read more about our different offerings and keep up. We have a blog that we talk through some of the different initiatives and happenings around Black maternal health. You know, people always want to know how to help. We're always definitely looking for funding. But I think one of the biggest things too, that you can, if you're interested in a groundwater analysis training, or you're interested in having more understanding around the larger systemic issues, contact us. That's something that we are we could do education and support around, but spreading the word is really what we need, and also funding. You know, we want to survive. So we're a new nonprofit, we're still small. So we definitely want to accept any and all things. And people always ask about donating. Sometimes we have space to take donations as well. We might sometimes filter them through the Maternal Health Equity Collaborative because we don't have a big space right now. But if you reach out and let us know if there's some baby items, or we do a big garage sale every year. So we do joint garage sale with the Maternal Health Equity Collaborative, where we are giving away any and everything, you know, baby clothes, gear, all of the things. So please go to our website, check out what we can offer. And I think I probably have talked over my time, but thank you so much. And that's us. I don't think there's any more questions. Okay.
Thank you so much, Starla, for sharing your work with Black Mamas ATX and everything that you're doing in the community. Again, if y'all have questions, the Q&A is open, or throw it in the chat and we'll have some extra time after our next speaker to answer some more of those. So now I'd like to invite Kristen Pierce-Vreeke to take it away.
Hi, thank you, Lauren. I appreciate everybody for joining us today. My name is Kristen Pierce-Vreeke, and I am the Executive Director of Austin Child Guidance Center. And I really do appreciate the opportunity to chat with you guys today. And for you, Starla, I'm so impressed and appreciate your presentation. It was a lot of really good information there. And it seems to me that there's plenty of space for us to collaborate at some point in the future. But for those of you that don't really know anything about Austin Child Guidance Center, we were established in 1951, and we are the first children's mental health organization in Central Texas. And actually this year, we're going to be celebrating our 70th anniversary or birthday. And so the founders, who were different teachers and mental health professionals and physicians in the community at that time, they embraced the team-based care approach to children's mental health. And so essentially what that means is that then and now we have social workers and psychologists, we have licensed professional counselors, marriage and family therapists, and we have a consulting psychiatrist, or in our case right now, we have a psychiatric nurse practitioner, who all work together using this guidance or child guidance model, which again is sort of remained the core of our. So it's a very creative model, one where we feel like doing so allows us to provide a really holistic approach to children and families. And I guess in the beginning of 2020, right before the pandemic hit, when we were working on our strategic plan, we changed, or we updated our mission. Not that the previous mission was bad, but I think we're trying to simplify it. And so our mission really now is to provide accessible mental health care for children ages 0 to 17 and their families. And the goal there is for them to thrive, yes, in childhood, but also beyond their childhood, right? So that they become well-adjusted individuals and adults. And as I think was read in my bio, I really do think that, well-adjusted kids become well-adjusted adults, largely, generally speaking. And, that sort of has a direct impact on our community. And so for us, we feel like we are really an organization that's, yes, about meeting families and children where they are, but also very much about prevention. And sort of all research suggests that the earlier you intervene, the better the outcome. And so that's really a big part of our goal. As everybody I'm sure who's on this call today knows, there's just too many kids right now dealing with traumatic in their lives, even outside of COVID, sort of abuse, neglect, domestic violence, being a victim of or witness to some other kind of crime, addiction, poverty, racism. All of these things were certainly problematic and prevalent prior to the pandemic, but when you put the pandemic on top of that, it amplifies all of these things, it magnifies all of these things. And there's just too many kids living with fear and anxiety, anger, frustration, the statistics around suicide rates for children and adolescents is at an all-time high. The last couple of years where we've all been isolated in our homes, it's been difficult for adults. So imagine that for an 8 or a 10-year-old or it's for some kids, it's been really crushing. And I guess to balance that point, other kids have thrived, I guess, in that environment. But if you speak to anybody anecdotally and emergency and such, the rate of people coming in with children that have suicidal ideation or who are feeling suicidal is our kids need the support of to help them navigate through these really difficult challenges and changes in their lives. I'm sorry, I'm kind of chatting and not advancing slides. But that's really, that's really where ACGC is looking to sort of position ourselves. We want to certainly be a resource for our individual clients, but we also want to be a resource for the community in general. So some of the community challenges that we're facing in Central Texas is, and Texas ranked #1 in the nation and has been for the last couple decades in terms of the number of uninsured and underinsured people. And so for many, that means that no insurance means that they can't afford to pay out of pocket for clinical services. There's a lot of private practitioners in Austin, and I used to be one, who are very, very busy these days. All of them are full, don't need to charge to use insurance, and it's a hassle, and so they don't. And so they're rightfully, charging, private rates for treatment, but that leaves a lot of people out, a lot of people who are not able to seek services as a result of not being able to pay out of pocket and needing to use insurance or not having it. The long-term impact of ACEs, which is adverse childhood experiences, I don't know that acronym, of Texas children right now have experienced at least one traumatic experience before the age of 17. And as for those that don't know, essentially the more ACEs that you have, the more dire your long-term consequences. And these are not just mental health consequences, these are also physical health consequences. And, the ACEs studies can show that, more likely to have, heart disease, more likely to struggle with certain kind of physical concerns as well as mental health concerns. And so again, as we talk about wanting to really be a resource to help prevent some of these ACEs, early intervention is really key. 61% of youth in Texas are experiencing major depression and did not receive mental health treatment in 2020. Again, in general, 1 in 5 people in this country, whether they're adults or children, are going to experience some kind of mental health concern in their lifetime. Most will not get treatment. And that also includes children. And so certainly, again, with the pandemic and all of the, I will say, collateral damage associated with the pandemic, this is an alarming number. And we are really passionate about doing as much as we can to families and these children so that this number certainly is much reduced. But it takes capacity and it takes funds and it takes a lot of things to sort of make that happen. And finally, as I mentioned, just the rise in suicidal ideation. 50% of children 11 to 17-year-olds have reported thoughts of suicide or self-harm. Anecdotally, I've spoken with people in the last couple of years who've had to attend funerals of children that are 8 years old, 10 years old. It is horrifying, it's heartbreaking, it's scary, and it's treatable. And so we really are focused and concerned with need in our community. And so one of the ways that we are doing that, and I'm going to skip over this to our, these are our kind of proposed solutions around sort of how we can address some of these things. And these are our 3 main programs: client care and treatment, professional development and training, and community education and awareness. And so, as it relates to client care and treatment, that's our kind of flagship primary program, which is where we offer a continuum of client services in the areas of individual, family, and group therapy. We have, I think, the only walk-in clinic in Central Texas specific for children. We are going to be offering psychological assessment again once we reopen. That was the one service that we did not resume through the pandemic, excuse me. When we closed in March of 2020, all services went remote, largely with the support of Impact Austin, with the exception of our psychological assessment services. We just felt that best practices dictated that we provide that service in person. And so while we were originally planning to reopen for in-person services on August 23rd, the Delta variant kind of made us push that back. And so we will resume psychological assessment services when we reopen later in October. But we have also, through the pandemic, maintained our psychiatric services for medication management. And so all of these things fall into our care and treatment program. The professional development and training program includes internships for master's level social work, counseling, and now marriage and family therapy students. We also have a postdoctoral student for practicums for PhD candidates. We also offer training opportunities for nonprofit, school district, law enforcement, juvenile justice workers, physicians, and others who provide direct support and care to children. I will say that, we have had to kind of scale back a little bit of some of our external trainings over the last year and a half, just because of capacity. But we are currently working on raising funding for a training institute, kind of a more formalized training operation, which would allow us to develop some new content that we would develop, and also to have a dedicated training staff so that we could do more of things in and around the community. And finally, we provide mental health consultation services through our IEC program to local early childhood educators, daycare centers, and schools through our infant early childhood program. And this is a really critical resource, as you can imagine right now. I think Starla mentioned the need for childcare, families needing childcare during COVID, where little ones, it's difficult for them to wear masks, certainly impossible for social distancing when you're talking about childcare for little ones. There's a huge stress on childcare providers who, as a group, are not really regulated in this state, so there's sort of varying degrees of education and information. And so our mental health consultation services, which is really a service provided for childcare center staff and administrators. We do work with some of the kids, but the primary function is to support the staff. And so we've had to be really innovative this year. We developed a warm line to communicate with the staff when we were not able to physically go into those centers for a long time. And a lot of space for growth in those areas. Sorry, I think So finally, our community education and awareness department really includes all of our kind of community opportunities, many of which are free, but we have workshops of various kinds dedicated for parents, for caregivers, and a lot of different topics: separation and divorce, temper tantrums, how to manage through COVID. There's a lot of different workshops that we've offered, all for free. We started doing it about a year ago. After last summer with the death of George Floyd, we started doing, initially they were kind of race panel discussions, sort of helping parents to find language and support around how to talk about race and racism with their children, how to better understand it themselves, how to make sense of what was going on. We have done those panels monthly-ish. And now not all of the panels discussions are about race, just different topics that are important for our community. So we continue to do those. And we also do kind of other education campaigns and presentations to community groups and organizations. And so again, I think just sort of back to the idea of being a resource for the entire community, not just a resource for our specific clients. Every child is different. So even if as a parent, you have a child or you've had but you've got a younger one or an older one, and as they are changing and growing, there are different things that come up. And so we really want to be a resource for everyone. one of the things that has been so important for us with Impact Austin is, we received a $75,000 Catalyst grant from them. And that was really key when the pandemic hit, because it allowed us to accelerate our implementation of teletherapy, allowed us to purchase technology and tablets and things, so the lending program for members, clients and members in the community, so that they could engage in teletherapy with us. It allowed us to broaden our outreach. Again, there was a discussion about gentrification and people moving out into more suburban and unincorporated areas. One of the sort of silver linings, I guess, if you will, of sort of pivoting to teletherapy was that it made our services available to everybody in the state. And while the majority of our clients are in Central Texas, there were people out in Bastrop and some of the kind of further areas, Georgetown, that in the past would not seek our services because the drive was just too long. Now we're people that could receive our services. And so the support from Impact Austin really allowed us to reach those families and to support those families. We had planned to kind of do our podcast, but, I guess I want to acknowledge Kathleen Mack, who was our grant kind of manager, who in one of our meetings with her, she kind of encouraged us and supported the idea of podcast. And based on that conversation, we accelerated that work and made sure we kind of got that out probably a little bit sooner than we were on track to do it previously. So Impact Austin and the members of Impact Austin have been hugely supportive of us. It really is folks like Impact Austin and others who allow us to do the work that we're doing. It's not easy. And there are constantly new kind of challenges that we face, like other nonprofits in the community. One of which is that there's a couple of large organizations that support many of the nonprofits in Austin, but given that we're such an entrepreneurial city, it's sort of shocking that there aren't more, which is why what Impact Austin does is so important, and why it's so meaningful. And just for me personally, as a woman who's sort of heading an organization that's largely kind of run by women, I sort of just really appreciate and want to kind of validate the fact that this is a female-led organization, and just sort of what a group of sort of passionate, conscientious women can achieve. And so I love it. I love our relationship with Impact Austin for that reason as well. So anyway, there's more that I could say, but I know we only got a few minutes left. So I just want to say thank you to everybody for supporting Austin Child Guidance Center. We are fortunately going to be able to have our big fundraiser this year, or in 2022. We haven't been able to do it for the last 2 years because of COVID. So Austin Originals will return in April 2nd, 2022. And this year we have a new venue. We're going to be at the Circuit of the Americas, which is a big deal for us. And so please stay tuned. We're going to hopefully announce our headliner in the next couple of weeks. Again, not being able to have our biggest fundraiser the last couple of years has been a real challenge. And so we're delighted to be able to sort of move forward with it. And we look forward to sharing more about that. And hopefully you guys will all come out and want to participate. There's going to be a much more family-friendly element to it this year. Thank you very, very much for inviting me today.
Thank you so much, Kristen, for being here and sharing some of that with us today. We're going to get into the Q&A in a second, so I'll invite Starla back on screen. And before I do ask some of the questions that we have, it's time for my Impact Austin plug real quick. That's why they pay me the big bucks here as the MC. And if you're interested in getting more involved with community partners like Black Mamas ATX and Austin Child Guidance Center, and just learning more about the work that's being done in the community that we share, I really urge you to take a look at Impact Austin membership. There's more information on our website at impactaustin.org. Feel free to reach out to me or any of the other members. We'd be happy to share our personal experiences with the organization. So I do have a question that came in from the Q&A during Starla's presentation. Beth had a question. If you could please expand on the concept of culturally congruent care here in Central Texas.
Absolutely. So culturally congruent care is essentially having a provider, or the clients that you work with, having providers that understand and are basing their care off of the knowledge and understanding and reflecting the culture of who you're serving. I don't know if that was like super clear. At Black Mamas ATX, that looks like us having Black women serve our Black clients. But we also know that, you know, amongst cultures, there's a lot of nuance. And so we are doing our due diligence and looking at the way we provide services and ensuring that they match the needs of the community and what they want. We understand that, you know, Black people are not a monolith as well. So really being very critical and thinking about the diversity within our Black community and what needs there are. That looks different from, you know, if you're living in the middle of Austin to out in Manor. And we also use a curriculum that was researched and based on Black women's experience with anxiety for our anxiety groups. And so the Soothe Your Nerves curriculum wasn't just created for anybody. It was created specifically for Black women with anxiety. And that's the curriculum that we were trained on and used in our anxiety groups. And so our doula model takes into account not only that it's a Black woman working with other Black women, but really understanding the effects of racism, cultural dynamics that happen, and making sure that we're operating in a way that matches the lived experiences of our clients. So in terms of how that looks in Central Texas, I know a little bit less about. I know that organizations are really, one of the things that we're trying to do also is grow more Black doulas. So we are offering trainings for Black women who are interested, and being able to continue to educate and grow the pool of providers that culturally reflect the women that we're serving. So I hope that was clear. I hope I answered your question.
Thank you. Thank you so much for providing that response. And we're running short on time. So I do have a question that I would love to ask, especially because this is the Women Leaders event. And I think it was very clear as I was reading both of your bios that you both embody that leadership role. And I was hoping that you could share a little bit about your journey into those leadership roles and maybe offer some advice or lessons learned kind of along your journeys.
Well, I'll start quickly just because I know we don't have a minute. So I went back to school as a kind of youngish mom and became a licensed marriage and family therapist. And honestly, I kind of just thought that I would do that for the rest of my life. Sometimes when you kind of find your thing later in life, I was extremely passionate about it, loved everything about it, just figured I'd do that forever. When I moved to Texas and started kind of working again as a clinician in different nonprofit organizations, and I found myself at Catholic Charities of Central Texas, and that was a much role that required a lot more administration. And again, initially I struggled. I wasn't sure I wanted to take that because I didn't think that I would want the admin pieces. But as it turned out, I actually found that the admin pieces were actually really rewarding because it allowed me to support and mentor other mental health professionals, which was really, really gratifying. And in ways that kind of, mirrored the feeling that I got working with actual and it was through my work at Catholic Charities that I kind of took on a much larger administrative role. We started doing teletherapy there long before the pandemic. We participated in Philanthropitch and other kind of large community organizations and efforts. And it just allowed me to really stretch in terms of the administrative pieces. I kind of gained a lot of confidence through that. As a mental health professional, you're and so being able to support others was really, really important. And when the opportunity at Austin Child Guidance came along, I tell this story a lot and I'll be really brief. I applied thinking that they would never, ever select me. Just because I figured I knew the reputation of ACGC. I figured there were people up there who'd had executive director experience, who had worked in larger organizations with larger budgets. Not that I couldn't do the work, but I just could not imagine a scenario in which they would kind of pluck me out of what felt like obscurity in that role. And I, through some, kind of twist of fate and lots of interviews, it worked out, and it has been the most rewarding job I've ever had. I'm kind of exhausted and tired, but also kind of invigorated and excited every single day. Every day is different. It's really hard, but it's also the most rewarding job that I would ever have. Do I struggle sometimes with imposter syndrome? Yes. Do I have to kind of consult with other female leaders and other people to kind of, remind me that I'm in the right seat and that this is work that's not beyond me? Yes. But it has certainly stretched me, but I'm so grateful for the opportunity every single day. And it is the most rewarding job I've ever had. So.
And I am just realizing that I need to start calling you more often, Kristen, because I think that the support piece that you're mentioning, especially for women leaders, is so crucial. And I don't know how sometimes I ended up in this place, but I think it's kind of because every job I've ever taken has really been, I've made that decision on if I'm going to feel passion, if I'm going to be invigorated by it. And I try my best to not take jobs just for the money. Like, I really need to be invested. I can't do it. I won't do the work well if I don't like it. And so, yes, I sometimes wonder how I landed here as executive director. I have also been stretched and learned and had imposter syndrome for sure. But being able to have community people know that I'm not doing this alone has been really, really helpful. And also, I think just, I think when you're in a position of being an administrator or in any kind of positions of being in leadership, having to be able to speak truth to powers is so important, and taking those risks have paid off for me, I think. So, when we know we're moving from the place of like being in right relationship, I feel like things flow easier. So yeah, thank you. Thank you for having me.
Thank you both so much for being here and for sharing all of the amazing work that you guys are doing. And thank you everybody for joining us today. And again, if you're interested in learning more about Impact Austin, any of our wonderful community partners, please visit impactaustin.org, reach out to any of us. We're happy to answer any questions that you might have, and hope to see you at some of the future events. Head to the event page on our website. We have plenty of things coming up, and we would love to share more with you. So thank you all for joining us.